everyone. This is Dr. Katherine from Live Your Life Integrated Health and Chiropractic. And today we are going to be talking all about pediatric chiropractic. This could be kind of a broad topic, so we are specifically going to talk more about some common conditions that we see in the office, how we treat these kiddos, common questions that parents have a lot. And then we're going to go over one study all about the safety of pediatric chiropractic. So I am going to pull up my screen. Okay, everyone can see that, but we are going to start with just generally, what is pediatric chiropractic? So a common misconception that people have is chiropractic is just for adults, it's just popping and cracking, and it's just for pain management. But we see a lot of kids in the office, from infants, toddlers, children, all the way up to teenagers. We use a diverse style of treatment that is always age appropriate. Some fun facts is 65% of neurological development, so that's like the brain, nervous system, occurs in a child's first year of life, and a child's spine lengthens by 50% in the first year. So with all this rapid growth, we want to make sure the baby is properly aligned, and everything is growing symmetrically. So some goals that we have is proper spinal alignment. So that's looking specifically at the spine, and all those segments that we have. We want to balance the body, all of the fascia and the muscles, and remove any nervous system interference that we might have. So that's going to be that brain body communication. And then let's move on to some common conditions that we see for infants, toddlers. So one of the most common things I see in the office is latching difficulties. So moms will come in and say, you know, my baby's not feeding very well. There's a lot of grunting, lots of sounds going on when we're feeding. Their latch is very shallow. It can be very painful for mom. So we always look to see if there's any tethered oral tissue. So that's going to be that lip tie, that tongue tie, that buccal ties in the cheeks. So we want to make sure that we clear those. And another thing that we see is ear infections. So a lot of the time kids will come in and kind of pull at their ear, they'll scratch at their ear. It's a good indicator that we might not be getting fluid drains all the way. And then body tension, physical patterning. That can be some torticollis. So if your baby is leaning to one side, if they prefer to only look to the right side, the left side, if they always have their hand up by their ear. And then another thing that we see is digestive discomforts. So that can be constipation. Baby seems kind of colicky. They spit up a lot. Abnormal sleeping. So again, a little bit of that colic. They wake up at the same time every night. They just cannot get back to sleep. And then some delayed milestones. If they are not crawling as they should, they're not walking at a certain points, we always look at that to see if there's some kind of misalignment that might be going on, or if there's any type of retained reflex that they might be having. And then moving on to our preschool aged kids. So some common things that we see again is sleep disturbances, if they're having nightmares, if they don't want to sleep in their own bed, if they are wetting the bed, and then again, some developmental delays, ear infections again, frequent illnesses. So if they are just going to daycare and they're constantly getting sick, and just can't seem to shake their illnesses, their colds, their flus, lots of trips and falls. So at this point, they are getting more confident on their feet. They're doing lots of running, jumping on the playground, bumping their heads, and then some growing pains. At this age, Everything is very gentle and low force. There is no popping and cracking when they are in the office. So some techniques that we use is craniosacral therapy. So that relaxes the muscle tone of these kids. We find positions of ease for them, and this helps increase that nervous system functioning. Logan Basic. I use this on little babies a lot, especially when they have not had a bowel movement for a couple days and are getting a little cranky. So with this technique, we all have a ligament that attaches to our sacrum, so our little triangular bone at the very bottom of our spine, and comes out and attaches to a bone in the pelvis. And when we stimulate this ligament and we release this ligament, it helps stimulate our parasympathetic nervous system. So that is our rest and digest part of our nervous system. So when we work in this area, it helps free up the sacrum so it can become nice and balanced, but also lets the baby relieve themselves. So we usually get a big full diaper after. And then going along with this Logan Basic technique, we can do something called spinal pressures. So that is just using a very, very light touch. And I will check out each segment of the spine. And if I feel any restriction in that area, I do a nice little hold. It is about the same amount of pressure as you would hold a tomato or hold a peach, and apply that pressure, and you would not bruise that fruit. So it's really, really, really light. And then another thing that we can do is something called an activator technique. And if you look at the bottom left picture, that is an activator. It's a little handheld spring powered tool, and it clicks. So with our littlest guys, I may use this on some bigger joints, like in the pelvis, so low back. But as we get a little bit older, kind of that 3-4 age, we might use this in different areas of the spine, but it is very, very light again and very specific. And then I will usually prescribe some at-home stretches and exercises, especially if we're getting some body tension, one-sided body tension. If we're getting any tongue tie, lip ties, we just want to stretch out that area. And if we have any retained reflexes, we might send home some exercises to do for the parents and the kids. Okay, and then we are going to move on to some of our older kids. So kind of our 5 to 12 and then 12 to 18. Some common conditions that we see are that poor posture. At this age, kids are doing a lot more or spending a lot more time sitting at their desks at school, a lot of more time doing homework. They're carrying around a backpack that is much too heavy for them. So we see a lot of kind of neck, upper back, a lot of that closed in hunch forward shoulders at this age. These kids are getting into sports, so kind of we'll see some muscle strains, a couple of ankle sprains, pulled muscles, and some discomfort if they take any hard hits. At this age, we start seeing some headaches pop up, some attention issues if they have a hard time sitting in class, digestive issues again. So this can be constipation, this can be diarrhea, and then some menstrual pains. So that those cramps around periods, and then any low back pain that they might have with that. And then another thing we also see is asthma. Treatment at this age, we can start transitioning into more of that traditional chiropractic. So more of that popping and cracking. We also use that activator and then something called drops. So if you come lay on the table, there's a little piece of the table that we can pop up and we can do an adjustment straight down. So you're going to be face down with these drops. Nice and easy again. More of that craniosacral therapy, just calming the nervous system. At this age, kids have a lot of worries, friends, families, school, sports. So we always want to balance out that nervous system and help them sleep at night and just decrease any of those worries that they might have. at-home exercises again, and then we can also start to transition into more fascial work, more muscle work. So cupping down there in that lower left, some kinesio taping, especially if we have any serious posture difficulties going on, and then any of those sports injuries react really well to that kinesio taping. Muscle scraping is going to be that middle right picture. We can do that pretty much anywhere in the body. Helps attract new blood flow to the area, so helps with healing, and then acupuncture as well. And then at this age, we can also start to talk about any supplements that kids might need. Okay, so now we are going to transition into talking about the safety of pediatric chiropractic. This paper right here is titled The Safety and Effectiveness of Pediatric Chiropractic, a survey of chiropractors and parents in a practice-based research network. So this looks at 777 pediatric clinical cases over 5,438 visits. These kiddos aged from less than a day old up to 18 years, and they were seen at these chiropractic offices for wellness care, musculoskeletal complaints. So that's going to be muscle, bones, digestive problems, ear, nose, and throat issues, neurological problems, and immune dysfunction. And they were treated using a couple different techniques. So something called diversified, that's like a traditional chiropractic adjustment. Thompson, so that's more of those drops that we talked about. Activator, craniosacral, and last one was a torque technique. And at 5,438 of these visits, these techniques were used. So they were getting adjusted. So over all of these visits and all of these cases, there were 3 separate reports of treatment-associated aggravations. So these are going to be muscle stiffness, spine soreness, and again, just being stiff and sore. So that's not very many cases. They looked over it and it was, oh gosh, 0.51% of the patient population, or 1 in 1,812 clinical encounters, they had a minor adverse events. So this was very, very small, and it was just muscle soreness. So that can happen at any age. And no, these kids were not referred out to the emergency room. They did not have to go see their other healthcare providers. So again, it's very, very small population and nothing scary happened to these kids. So the next thing we're going to talk about is, again, just some hesitations that parents might have with bringing their kids in to see a chiropractor. Again, misconception that we're going to be forcing these big adjustments on these little kids. Their spines are very different. You might hear some people say, oh, you know, it's just a spine on a smaller scale, which is not true. Each kid has a unique biomechanical features of the spine, so that does affect the way that we adjust them. They move in different ways. They have different ligament laxity. So it's important to have someone who has specialized pediatric training, both with adjusting and the clinical aspects, to make sure the kid is receiving the right diagnosis and receiving the right treatment. When I see kids in the office, I always meet the parents and the patients where they are. I don't force these big adjustments on them. If they want to stay really, really low force, that is totally okay. We're going to get the same outcome. It's just going to look a little bit different. So with these kids, again, there's not going to be popping and cracking with our little kids, and we always check and get consent with parents and the patients before we start treatment. Okay, so some common questions that I get in the office are, when can my child be adjusted? Uh, they can never be too young. I think the youngest kid I have seen has been a couple hours old. Their parents brought them by the office as they were leaving the hospital. So never be too young, and never be too old. What does a visit look like? So, when we get a new pediatric patient in the office, we always start with a very thorough history, starting from birth. If there's any stressors that mom might have experienced during her pregnancy, that can definitely affect the baby as well. So, we always go over pregnancy history, how birth went, if there are any complications with that, um, how the first week went, how the first month went. And we always dive more specifically into any or the reason that they're coming in for the office too. So after we go through history, we start our exam. I always look at a general observation of the child. What is their face like? How does their body lie? How do they sit in the office? How do they communicate with me? Um, and then we dive into some more physical aspects. We look at range of motion too. So, kind of the same thing as an adult visit would look like. We look at reflexes. We look at how the joints are moving, how the muscle tone feels. So, similar to an adult appointment in some ways, and then specialized in some others. And then, how do I know when my child needs to be seen by a chiropractor? Um, all of those common conditions that we talked about at the beginning of the presentation are all good indicators. But I also tell parents, if they're infants, whenever you're packing away clothes, going up to the next size, that's always a good indicator. That's like, oh, maybe I should get the kid checked out just because they might be going through any growth spurts. Any big life changes that the kids might be going through. And then some of my older kids, I always like to see them before a big sporting event, sometimes before a big soccer tournament, a big gymnastics meet, making sure everything's aligned, working as it should, and then always after any big weekend of sports, any new injuries that they might have, any new stress that they might have put on the body. So it's always a good time to come get checked out. And then going back to, again, the beginning of the presentation, kids can also be seen just for wellness as adults. They're growing at a rapid pace most of their childhood. So it's good just to make sure that everything is aligned in that way. They're changing every day, and chiropractic can help them succeed during school, with their friendships, and then with any activities that they might have as well. These are a couple of resources. If you have any other questions, want to look at any other resources, any different studies, the ICPA is great. They do a lot of studies throughout the year and have those listed on their website. The ACA is also good for research. If you're interested in chiropractic in general, it's also a good website to check out. And then our website also has a great pediatric page with some more information, some things that we talked about today in the presentation. And thank you so much for joining me today. Please let me know if you have any questions or concerns or want to discuss anything that we might have talked about a little bit more. So thank you.